Welcome to The Explainer. Our whole goal here is to take really complex topics, break them down, and give you the key insights you need, all with a few simple, focused slides.
So, today we're talking about Ozempic. You've definitely heard about it, right? It's that drug that's become a total phenomenon for weight loss. But could there be a hidden risk? New research has brought up a really serious question, a potential link to sudden, and get this, irreversible blindness.
Ozempic didn't actually start out as a weight loss drug. It was originally made to help adults with type 2 diabetes control their blood sugar. But then, this pretty powerful weight loss side effect kicked in, and boom, its use just exploded, way beyond what it was first for. And, well, with that kind of popularity comes a whole lot more scrutiny, right? People start looking at all the potential effects.
All right, so let's dive into this. To really wrap our heads around the risk, we have to start with the basics. We've got to get a crystal clear picture of the specific medical condition we're even talking about here.
So, NAION. It's the #1 cause of sudden vision loss that's related to the optic nerve, especially in adults over 50. And, when you read that definition, a couple of words just jump off the page. Irreversible and untreatable. That right there is why any potential link, even a tiny one, has to be taken so seriously.
Now, it's super important to understand that NAION doesn't just appear out of nowhere. It's not totally random. There are some common health issues, things like diabetes, high blood pressure, stuff that affects your vascular system that already put a person at a higher risk of developing it in the first place.
And that brings us to this number, 66. That's the average age someone develops NAION. It's almost always a condition that hits people over 50, which, if you think about it, makes sense. That's the age group where those other risk factors we just talked about, like high blood pressure and diabetes, start becoming a lot more common.
Okay, so now that we have the background, let's connect the dots. What does the latest evidence actually show? How does all of this circle back to Ozempic and its active ingredient, semaglutide?
So what happened was, researchers did this huge study. They looked at data from over 424,000 people with type 2 diabetes. And what they did was pretty straightforward. They compared the folks taking semaglutide, that's the stuff in Ozempic, to people taking other common diabetes drugs, just to see if there was any difference in what happened to them.
And well, here's the big headline finding. The study found that using semaglutide was linked to a 2.81 times higher relative risk of developing NAION compared to the other drugs. Now, that number sounds big, right? It's a major statistical flag. But the most important word there, and we're going to come back to this, is relative. Okay, so what does 2.81 times higher actually mean in the real world for an individual person? Well, that's where this next number is absolutely crucial. This is the absolute risk increase, and it works out to just about 1.4, so let's call it 1 or 2, additional cases of NAION for every 10,000 people who take the drug for a whole year.
And really, this is the key point to take away from all the data. That relative risk number, 2.81, sounds kind of scary, but the absolute risk, it's still really low. The event itself is just super rare. We're talking about maybe 1 or 2 extra cases for every 10,000 people treated for a year. It's all about perspective.
So now we have this finding, right? A risk that's statistically real, but in absolute terms is very small. So what do we do with that information? What's the practical advice here for both patients and their doctors?
When you look at the guidance, it really comes down to 2 things: being vigilant and talking to each other. For doctors, it's about making sure their patients know about the risk, keeping an eye out for any vision changes, and really thinking about a patient's whole health history. And for patients, it's about knowing what to look for and, crucially, seeking help right away if anything seems off. It really is a partnership.
Look, if you take away only one single thing from this explainer, please let it be this. This is the key symptom to watch for: sudden, painless vision loss in one eye. If that happens, it is not a wait-and-see situation. It is a get medical help immediately situation. That's the bottom line.
Okay, so let's step back and look at the bigger picture. How do we put all these pieces together and make sense of what this all means?
This quote from the research analysis really just hits the nail on the head. The severity of NAION justifies caution. And that's it, isn't it? Even though we need more research to be 100% sure about the link, the fact that NAION is so severe that it can cause permanent blindness means you just can't ignore this risk, no matter how small it might seem.
And let's be clear, the goal here isn't to scare anyone away from a medication that's doing a lot of good for a lot of people. It's the opposite. It's about empowering you with information. It's about understanding that with powerful drugs like Ozempic, there's always a trade-off.
You have these huge, life-changing benefits, and you have to weigh them against risks that might be rare, but are also very, very serious.
And that really leaves us with a much bigger question, doesn't it? One that goes way beyond just Ozempic. In this new era of incredibly powerful medicines, how do we get better at weighing these amazing, life-changing benefits against risks that are maybe rare, but also devastating? It really shows that in the end, making a truly informed choice, together with your doctor, is the most powerful tool any of us have.